Welcome to Nurse Mentor. This is the second part of review of competitive exam questions, staff nurse. Today we are going to discuss staff nurse exam questions regarding child health nursing. We are discussing 12 questions today. Moving to the first question. Question number 1. Normal temperature of a neonate is A. 36.5 to 37 degrees Celsius, B. 37 to 39 degrees Celsius, C. 34.5 to 37.2 degrees Celsius, D. 36.5 to 37.2 degrees Celsius. Answer D. 36.5 to 37.2 degrees Celsius. Normal body temperature of a neonate in Fahrenheit is 97.7 to 99.5 degree Fahrenheit. Normal body temperature of a pediatric is 36 to 37.5 degrees Celsius, that is 96.8 to 99.5 degree Fahrenheit. Question number 2. Neonate is called A. 0 to 7 days, B. 0 to 28 days, C. 1 month to 1 year, D. 1 to 3 years. Answer B. 0 to 28 days. 1 month to 1 year is considered as infant. Babies from 1 year to 3 years is considered as toddler. 3 to 6 years is considered as preschooler. 6 to 12 years is considered as school age, and 13 to 18 years is considered as adolescents. Question number 3. Sunken fontanelle is a sign of A. Dehydration, B. Hydrocephalus, C. Down syndrome, C. Turner syndrome. Answer A. Dehydration. There are two fontanelle in infants, anterior and posterior. Posterior fontanelle closes in 1.5 months after birth, while anterior fontanelle closes in 1.5 years. If the fontanelle is firm and curve inward to slightly touch, it is called as sunken fontanelle. And if this is noticeable, it indicates infant does not have enough fluid in his or her body, that is dehydration. Question number 4. Which of the normal skin variation is not present in newborns? A. Milia, B. bruises, C. Vernix caseosa, D. Mongolian spot. Answer B. Bruises. It is the discolored skin followed by a blow or rupturing of underlying blood vessels. Milia, Vernix caseosa, and Mongolian spot are commonly seen normal skin variation in newborns. Milia is small, white bump-like cyst commonly seen on nose, cheek, and chin of a newborn. Vernix caseosa is a cheesy-like white substance seen all over the body of a newborn for a few hours after birth. Mongolian spot is also a pigmented birthmark on the skin. Question number 5. Normal hemoglobin level of a neonate is A. 11 to 16 gram per deciliter, B. 17 to 20 gram per deciliter, C. 14 to 16 gram per deciliter, D. 10 to 12 gram per deciliter. Answer B. 17 to 20 gram per deciliter. In case of adult, Normal hemoglobin level for males is 14 to 18 gram per deciliter and for females 12 to 16 gram per deciliter. Question number 6. Descent of testis occurs A. Before birth, B. 16 weeks, C. 24 weeks, D. After 7 months. Answer A. Before birth. Question number 7. Which of the following is not a sign and symptom of respiratory distress in neonate? A. Cyanosis, B. Intercostal retraction, C. Bradycardia, D. Tachypnea. Answer C. Bradycardia. In respiratory distress, neonate will not show bradycardia. Including cyanosis, intercostal retraction, tachypnea, the other symptoms are nasal flaring, stridor, wheezing, and grunting. Question number 8. Identify at-risk infant from the following. A. Infant with diarrhea. B. Malnourished baby. C. Down syndrome baby. D. Low birth weight baby. Answer D. Low birth weight baby. Question number 9. Following an exposure to a tuberculosis infected family member, a 12-year-old male is screened for TB with a PPD, that is Mantouxi test. After administration of the test, when should he board back for reading of the result? Options. A. 24 to 36 hours, B. 36 to 48 hours, C. 48 to 72 hours, D. 72 to 96 hours. Answer C. 48 to 72 hours. After administration of Mantouxi test, the reading should be done after 48 and within 72 hours. In a Mantouxi test, a small pale bump forms at the site of injection. If the size of the induration is less than 5 mm, it is considered as a negative case for TB. If the induration size is at least 5 mm, it is considered as positive if the patient has a recent contact with the TB patients, or if the patient is an HIV positive, or if the patient is after an organ transplantation, or taking any immunosuppressive medicines, or a previous history of tuberculosis. If the induration is at least 10 mm, it is also considered as positive. And the reasons are if migrated from a country of high incidence of tuberculosis, if the person lives in a high risk environment, if works in a high risk settings like TB ward, if the child is under 4 years, or if the person is under injected drug abuse. If the induration size is 15 mm or more, it is a positive case. Question number 10. What should the nurse do before administering a tube feeding to the infant? A. Irrigate the tube with water. B. Slowly instill 10 ml of formula. C. Provide the infant with a pacifier. D. Place the infant in a Trendelenburg position. Answer C. To meet oral needs and help the infant to connect sucking with feeding, the nurse should provide pacifier while administering tube feeding. Question number 11. A toddler diagnosed with a nephrotic syndrome has a nursing diagnosis of excess fluid volume related to fluid accumulation in the tissues. Which measure should the nurse anticipate including in the child's plan of care? A. Limiting visitors to 2 to 3 hours a day. B. Maintaining strict bed rest. C. Testing urine specific gravity every shift. D. Weighing the child before breakfast. The answer is D. That is weighing the child before breakfast. Daily weight measurement helps to determine the fluid gain and loss. It is the best indicator for the fluid balance. Limiting visitors and bed rest may provide adequate rest to the child but not have any relation to fluid balance. Urine test in nephrotic syndrome is for protein but not for specific gravity. Question number 12. A child diagnosed with Wilms tumor undergoes successful surgery for the removal of diseased kidney. When the child returns to the room, the nurse should place the child in which position? A. Modified Trendelenburg. B. Sims. C. Semi-Fowler's. D. Supine position. And the answer is C. Semi-Fowler's position. This is commonly used in abdominal surgery to facilitate abdominal drainage due to surgery and promote pulmonary expansion. Modified Trendelenburg position is only provided in case of shock. Sims position is not recommended because of the large transabdominal incision during the removal of kidney. Supine position also has high risk of aspiration for the child. If you like this video, please don't forget to like, share and subscribe. Please comment for any modification and suggestion. Once more, thank you very much for your support.